Hi, Mr. Smith. I'm Claire. I'll be your student nurse today. So, you said that you have pain in your leg and you rated an 8 out of 10. I know you normally take aspirin in the morning. I can give you that, but I want you to know that the aspirin really won't help with your pain. That baby aspirin really isn't a strong enough dose to help with pain. It's more so for your heart. So I would recommend taking Tylenol for the pain. And then if that doesn't work, we can up it to an NSAID like Advil. But I think we should start with Tylenol for the pain this morning and see how that works. All right, it is 0750, and Mr. Smith is due for his lasix or furosemide at 0800, and I'm about to prepare his meds and do the 3 checks before I give it to him. So I'm going to do 2 here and then 1 by the bedside. So the patient is Sam Smith. I have his MAR here in front of me. Can't really see it, but it's there. So the patient is Sam Smith. The medication is furosemide, PO. It is 40 milligrams per tablet, and it is within the time frame. So that is 1. And then the patient is Sam Smith, furosemide, PO, 40 milligrams tablet. So I'm gonna put out 1 tablet here. Get the 1 tablet, 40 milligrams tablet, and it is within the time frame. So I'm going to bring this to Mr. Smith's bedside and do my last check there. Okay. Hi, Mr. Smith, it's me, Claire, again. I'm here to give you your furosemide, or you might know it as lasix. And I understand that you're having some trouble with taking this because it is making you pee a lot throughout the night. I know that's very frustrating. However, you really need to stay on this medication to help with your heart failure, and to keep your high blood pressure under control, because that can cause a lot of other effects and symptoms that are a lot worse than having to pee at night. However, I'm going to talk to your primary care physician about possibly taking the last dose a little earlier in the afternoon, and hopefully that won't affect your sleeping as much, because I know that must be really difficult having to get up a lot throughout the night, and it also must be difficult now that you're struggling with your leg, but I will talk to your doctor about that. But for now, this is Mr. Smith, furosemide or lasix, 40 milligrams a tablet, so that's 1 pill, by mouth, and it is within the time frame. And so here is your lasix and some water. I've just read Sam Smith's provider orders after passing his meds, and he is due for a CT scan with IV contrast this afternoon. However, Mr. Smith is on metformin for his type 2 diabetes, and a patient should not be taking metformin and have IV contrast, because that can have serious kidney issues. So I'm going to call his provider and inform him of Mr. Smith's metformin. I'm also going to talk to the provider about Mr. Smith's furosemide dose, and just see if we can push the furosemide, the last dose of furosemide, earlier in the afternoon. So I'm going to call the provider right now. Hi, this is Claire. I've been taking care of Sam Smith today. He is an 82-year-old man. He's 2 days post-op of an internal fixation of a femur fracture from a mechanical fall at home. His post-op course has been pretty uneventful with the exception of some anemia, which required 2 units of packed red blood cells yesterday. And I've just checked the orders and he's due for an MRI with contrast this afternoon. He has a past medical history of congestive heart failure, coronary artery disease, hypertension, type 2 diabetes, rheumatoid arthritis, and a bilateral hearing impairment. He also has an allergy to penicillin. And when I was administering Mr. Smith's furosemide this morning, he was complaining of having to get up frequently during the night to urinate. He stated that he gets up every 5 minutes throughout the night. In addition, when I was looking at his medical record, Mr. Smith is on metformin for his type 2 diabetes, and I just wasn't sure if you were aware of that. And due to his upcoming MRI with contrast, I would strongly recommend we hold Mr. Smith's metformin for the next 48 hours and put him on a different insulin routine if necessary, just to keep that blood glucose under control. And after 48 hours are up, we should probably run some kidney labs and make sure everything is looking good, and then we could put him back on the metformin. In addition, I'd recommend giving the second dose of furosemide earlier than 2000 hours, just so hopefully that won't affect Mr. Smith's sleeping and he would be more willing to stay on his furosemide. Let me know if you can make these changes. Looking forward to getting back to you and informing Mr. Smith. Thank you. Bye. Hi, Sam. So I hear you've been curious about the new heparin that you're on. So you're on heparin right now. It's a blood thinner. You're taking it because of the surgery you just had on your leg. Sometimes after surgery, especially when people have surgery on their leg, they can get blood clots, which can lead to complications like strokes or a deep vein thrombosis, especially because you're not able to walk as much. So hopefully this heparin will prevent any blood clots. You most likely will be able to come off of it once your leg is healed. But right now that is what your heparin is for. I know it's new. It might be confusing. You can always ask more questions if you want, but another thing about heparin is because it is a blood thinner, you're more likely to bruise easily. So just be careful of that. And any other questions you have about heparin, be sure to ask me. I'm here for that. Hi, Sam. So I see you're struggling eating breakfast. I know that you said the Tylenol isn't working. You normally take 5,000 milligrams at home for pain. So I'm really sorry the Tylenol isn't helping your pain, but I really don't want to give you over 4,000 milligrams a day, because that can cause some serious liver damage. I also would encourage you to try to lower your dose of Tylenol once you get home, if at all possible. However, I can give you some ibuprofen or Advil for your arthritis pain, which I think might help a little bit more than Tylenol just because it helps with pain and inflammation. So I can get you some of that right now and we can see how that works. Hi, Sam. So I hear you're feeling some pretty bad pain, 9 out of 10 on that leg. However, I can't give you Tylenol right now because it hasn't been 4 hours since your last dose, and I don't want to cause any liver damage, right? We want to avoid that. So I can give you some Vicodin. That's a combination of hydrocodone and acetaminophen. It's a lot stronger, but the dose of acetaminophen will not put you over 3,000 milligrams of Tylenol, which is around what we want to stay at. So your liver won't be damaged or affected in any way. Vicodin is a lot stronger. It can be addictive, but taking it as prescribed for your pain will not make you an addict. Some side effects could be it makes you feel dizzy, drowsy. You might experience some nausea, vomiting, or constipation. Constipation is actually very common. Please let me know if you're experiencing any of these symptoms or if they get worse, but I feel like some Vicodin might help your leg pain a little bit more than Tylenol will right now, or any ibuprofen. So if you would like some, I can get a dose of that and we can monitor and make sure that that works out for you. Okay?